Hey, all you beautiful ethic cuties and the 40% of you who have still not subscribed to the Ethicsverse, what the heck's wrong with you? It's free. Welcome to the coolest place to be every Tuesday at noon Eastern. If you think fixing our workplaces will fix our world, we got a real treat for you today. We are diving into navigating the regulatory maze, strategic approaches for healthcare compliance. You know, we love healthcare on the Ethicsverse, and so we are creating these special sessions on Tuesdays to add some more value to the healthcare market. So as we get started here, like we say every Thursday and every Tuesday now, your network is your net worth. Neither are big enough. So drop that LinkedIn URL in the chat and connect with someone today. You know, the benefit that ethics and compliance in general has is like 10x in healthcare because we are dealing with so many of the same issues and so many of the same challenges. So I really encourage you to take advantage of this really unique asset that we all have in the community that we're all a part of and connect with someone, build that network out. It's never, as I've reached out to anybody, it's never come back void. I've always gotten some great insights, and I encourage you to do that as well. I also encourage you to check out the Ethico library. We're going to be at a bunch of conferences this week. We will be at HCCA giving away a bunch of books. We're going to be at Compliance Week giving away a bunch of books. I don't even like making money around here. I just like giving away books. So check out the Ethico library with this QR code here and see a bunch of this great thought leadership that is out. A bunch of cool new books have dropped. Powerful Phrases for Workplace Conflict is on my nightstand right now. And if you haven't read it, I'd encourage you to do that. Also encourage you to follow some of these podcasts that are coming out with great episodes constantly. Ethical Machines is one of my favorites. Two Gurus Talk Compliance I love, of course. Great Women in Compliance podcast, who I will be interviewing both Hema and Lisa Fine at the Compliance Week conference. So if you're coming to that, definitely come to that women's brunch and get some tips from two of the great women in compliance, and also get some tips from the ethics experts. So we've blown past 200 episodes. We have the fastest growing ethics and compliance podcast in the world. Imagine that. Top 2% global podcast. And that's just because we get great guests and they are so generous with their frameworks and so generous with their tips. So I encourage you to download that to exit when you walk your dog or as you drive to work. And as always, for the best comments in the chat, the best questions in the chat, we're giving away 5 of another of the OG Great Women in Compliance books, Level Up from Mary Shirley. So we're giving away 5 of those. And Mary Shirley is like a goddess of compliance, of course, but also a goddess of healthcare compliance. So there's a lot of great tips in here that you can utilize to drive your program forward. So I encourage you to really participate in this chat. The chat is always popping off. You know, somebody said, I don't even listen to the podcast, or I don't even listen to these webinars. I just mute you, Nick, because all the action is in the chat. So let's keep that going for today. I want to share this really cool tool that we've just built. You know, we are pouring a ton of money into our platform because it feels like ethics and compliance is really at this pivotal point, and the next 10 years can look way different than the last 10 years. But we have to do things differently. And when we can give people who care, smart people who care, better tools, they can really, really broaden their impact. So check out this Ivy Eco Bot. This thing is phenomenal.
Meet Ivy, the EcoBot that's transforming the way employees report concerns. Ivy is not just another chatbot. She's your organization's newest compliance ally, designed to make reporting more intuitive and user-friendly than ever before. Whether embedded on your compliance portal or employee intranet, Ivy meets people where they're at by seamlessly integrating with MCR. In today's fast-paced world, your employees expect convenience. Ivy delivers 24/7 availability across all devices, turning what was once a cumbersome reporting process into a simple conversation. The result? Higher reporting rates, better quality information, and a stronger speak-up culture that protects your entire organization. EcoBot Ivy, making reporting as easy as having a conversation.
What a cutie, that little Ivy, huh? So if you're interested in that, check it out. We have a cool promotion going right now. So if you're coming from any of these legacy providers and you feel like the love is gone and the romance is over and you just want to see what else is out there, go to our website and click for a like we call it, a no pitch zone demo, just to see what's out there. It's incumbent on you to make sure that you are putting the ball in the net, as I say. And that starts with having the right tools and having the right resources in place. And if you have not checked out our healthcare benchmark report, we will drop a link in the chat right now. We have enough data here with our healthcare focus and our healthcare concentration to have really good benchmarks across different healthcare sectors. So if you have not downloaded that yet, check it out. If you're interested, drop a 1 in the chat and we will send you a cheat sheet, the summary, so you don't have to read the 40-page report. Although I would say it's really well written. Okay, I'm a little biased, but I think it's really well written. Quickly, if you have not contributed to Diana Trevely's GoFundMe, I would encourage you to do it, and I would ask you to do that. I don't really ask for anything of this market that we're all a part of this community that we're all a part of. But Diana was in Argentina. She is currently in a coma after a really terrible accident, and we're trying to help her and her family get her back home. Medevac is extremely expensive, and we want to get her back home to get the care that she needs. So if you have not contributed yet, I would encourage you to do that. You know, tax returns are coming. You probably got a couple of bucks stashed away for a rainy day. And it is a little bit of a rainy day down in Argentina. So we'll drop that in the chat as well. All right. With all that, I would like to introduce our amazing panel. Let's get a massive emoji explosion. Let's get a new Tuesday record today for emoji reactions. I don't think we're going to have a problem because we got some real genius on the show today. So we got Donna Schneider. She's the VP of Corporate Compliance and Internal Audit at Brown University Health. We got Laura McNamara, Compliance and Privacy Officer at Stony Brook Medicine, and Stephanie Popoulis, General Counsel, Corporate Secretary, and Compliance Officers at USI. So emoji explosion, let's launch in. Today we are going to be, forgot one thing. There's a really cool conference coming up. Why don't you guys tell us about this conference? You guys can circle your calendars right now. Pull up your phone or pull up your calendar and mark out December 3rd through 5th. Of this year. Tell us a little bit about this conference and what people can come to expect from it.
Yeah, thank you so much. Yeah, so NEHIA is the New England Healthcare Internal Auditors Group. We partner with HFMA and have a joint conference every year. This year, we'll be celebrating 31 years of this conference. We had a big 30-year celebration last year. We're keeping the good vibes going with our 31st year. Lots of great information on healthcare compliance, internal audit, privacy, and professional development. This is a great opportunity to really collect a lot of CEUs and to network with some really incredible folks. So we hope to see you there.
All right. Well, very good. So we are going to get started. We are talking today about navigating the regulatory maze. There's so much change happening in our industry, in our economy. So I just want to kick off our conversation with this question. Give me a brief overview of some of the most significant regulatory changes that are currently impacting the healthcare sector. Why don't we start with you, Donna?
I think this has been going on for a while, but I think the split shared documentation process. So that changed a couple years ago. And in order to stay ahead of it and make sure that both the clinicians and the nurse practitioners and PAs are aware of what the documentation guidelines are, it's a constant reminder. So that to me has been something that's been really significant that we try. We have a healthcare system with 6 hospitals, 2 large physician groups, behavioral health group, and 20,000 people that work here. So with the change in personnel that goes on by natural attrition, staying on top of that and in front of that and making sure the documentation is done correctly is a real challenge.
How about you, Laura?
Thank you. And first, if I could just take a moment, it is so cool to see so many attendees today. I love that so many people are here taking time out of their busy day or even their lunch hour to sit and hang with us. And it's so great to see so many familiar names, really, and seeing the chat going. Brittany, it's so good to see you. Thank you. To all my colleagues at Stony Brook Medicine, thank you for being here. And all my soon-to-be colleagues at the University of Vermont Health Network. I'll see you in just a few weeks. Can't wait to work with you. Okay, so the current landscape, well, it's full of potholes, right? Let's talk about telehealth regulations, right? Many regions are relaxing some licensure and reimbursement rules around that, so we have to stay on top of that, especially if you work in a multi-state system. We've got issues on the landscape for data privacy and security enhancements, Drug pricing transparency comes to mind. We always have to think about our value-based care incentives in the evolving world as we move away from fee-for-service to value-based payments. And then, of course, AI and digital health regulation. There are new frameworks that are emerging to oversee AI-driven tools and how we use those, and to make sure that we're still focusing on safety, efficacy, and, of course, ethical use.
Amazing. How about you, Stephanie? What would you add?
So I would add, I would probably piggyback on the fact that we're in several states, and so every state is dropping regulations on privacy. That is a huge pothole, because you're doing business and how it's working with your patients, how it's working with your employees, and whether or not you're adhering to those state privacy laws. We're private equity backed. There's been so much legislation on a state by state basis with regard to private equity backed transactions and regulations on those, so that impedes your ability to move quickly, which private equity has always been really, really quick. And so it could put back a transaction 6 months to a year, having to meet all those state requirements on top of CMS and healthcare regulatory changes that happen every single year. So, I mean, there's such an opportunity for us to have our finger on the pulse of these regulatory changes, because, you brought up the private equity thing. So many deals can fall apart during diligence when things are not dialed in to the extent that, is articulated in the investment banker book. So whether you're private equity owned or whether you're, not private equity owned, these changes really can come from multiple sources, and they can come really quickly. Let's start with you, Stephanie. Can you share how you and your organization stays informed about these upcoming changes at the federal and at the state level? Like, what sources do you guys find most reliable for these timely updates? So can I list names? So we use several different sources, and I'm also, on the cheap, right? We're trying to keep it economical. So, in every state that I'm in, we've got different state legislative sessions every year. So I'm dialed in, getting those updates on different bills and so forth that are going to affect the team and are going to affect that particular state. So, I do use a combination of subscription services to kind of stay on the pulse. I also rely on, some of our law firms.
You can say names. That's fine. Yeah. It's all good. Listen, there's a lot of fish. There's enough fish for everybody. So we're all good.
Yeah. So, I use Bloomberg. That pretty much keeps us on track as well.
Very good. How about you, Laura?
I live in the world of proactive monitoring. So we are constantly tracking regulatory developments. We stay on the Federal Register. So my morning is spent looking at a lot of the emails that are coming in from our listservs. That's the Federal Register. That's from CMS. That's from our Medicare Administrative Contractor, NGS. I also sometimes dabble in other MACs as well, just to see what's happening across the country. But another way where I get to pick the brains of others is through cross-functional collaboration. So I really like to speak with our operations teams and teams in other shared services. What are you hearing? Pass along to me. If you're part of if there are providers and medical physicians that are part of certain organizations, what are you talking about? Send it my way. I need to cross-check with the regulatory guidance to make sure we're aligned.
Donna, anything to add?
I think similar to Laura, we have an informal group that is a combination of compliance, different aspects of patient financial services, medical advisors, and we meet once a month on a Friday, and there's no agenda, but it's really just talking about what's hitting everybody's radar or inbox, and that's been incredibly helpful. The other thing that I rely on is the report on Medicare compliance, because I feel like that's a really good source of information to know how different things are impacting other health systems, and really things like this, joining professional associations, you talk about networking and expanding your network, Nick. That's critical, because you can't do this job by yourself. You can't know everything. It's impossible. So calling up, whether I'm calling Laura or I'm calling another friend or I'm calling somewhere I've worked previously and talking to them, that's critical to be successful and to have your program continually evolve.
Yeah, I mean, you get no bonus points for finding your own way through the forest if there's already a trail there. You know what I'm saying? And like the worst thing a compliance department can be is that barnacle on the ship or the bumper sticker on the car. We have to integrate with the rest of the organization. And I love that idea about that Friday meeting with these different departments so that we can truly integrate and make sure we know what's kind of on everyone's radar. Barbara Goodman had a great question, or I guess it's more of a comment here. Thank you, Barbara, for sharing this. I'd love to hear how folks are using AI for regulatory intelligence. We use Westlaw and CMS, trade associations, et cetera. Anything to add about that? I mean, you know, is it a webinar if we're not talking about AI? You have to mention it at least once. Okay.
Right. Yeah. I don't have, our organization, unfortunately, is not, I think, where we should be with that. So I don't really have anything to add to that. Just a learner at this point.
And I think many people would say that, right? We're still learning. We're still dipping our toes in. We're in a place right now where we're getting requests for proposals to learn more about how AI can impact the work that we do. We are, of course, use AI technology for our EMR program to help. It's called Fair Warning. We use the Cerner electronic medical record. And that helps us with safeguarding protected health information for our privacy and HIPAA work. But as far as going out and using AI to help us with risk stratification, identifying assessments, we're not there yet, but we want to learn more. We want to find ways that we can lean on AI to help supplement and enhance our program, not take over.
And I think AI. Please go ahead.
I was going to say, I think AI has been tremendous in working on the privacy piece and the patient privacy monitoring, looking for those snoopers. That's been just incredibly helpful over my tenure here. And the only way to really hone down that and really look to see, because it's amazing how people either don't realize or conveniently forget or what happens that they shouldn't be in a medical record if they have no business use to be there.
I would like to just add to that. One place where I would like to see AI work is in some of our staff training platforms. I think the use of the bot, like you have, Nick, I think those are incredible opportunities to be able to answer questions quickly, get someone to a policy, get someone to a procedure that doesn't necessarily need a phone call, leave a voicemail, wait on an email. To have AI there for some of those very quick first response types of situations that come up.
And what I'm really encouraged by is like the openness for AI in compliance, particularly in healthcare. I don't know if it's because healthcare compliance folks have like stronger sea legs or something, you know, because we're constantly bombarded with the storm of new regulation or whatever it is. But it seems like a little bit more openness on this side of the fence. And I think it's really encouraging. You know, I'm kind of fascinated, though, with like, how do we navigate through this storm? Or, you know, the title of this episode is about navigating the regulatory maze. So, like, how do you anticipate the effects of these proposed regulations? How do you integrate that, you know, with your planning? Like, what kind of methods do you use to assess this potential impact of these regulations before they're finalized? Like something, you know, you might hear a rumble of something, or something may have just been released. What sort of a process do you utilize to, assess this potential impact and integrate into your priority list?
I mean, I'll chime in. I mean, I think one of the first things I do is I get my team together. I get my C-suite together, because they're going to have a different perspective. The CFO is going to have a different perspective from the CIO on any type of regulatory thing coming. So they're usually my first touch point on how I determine how this is going to roll down, whether it's going to be an RCM hit, if it's going to be a clinic hit, how it's going to roll, how that regulation is going to hit every part of the organization. So I typically, and there's no surprises. If you're watching all these regulations, if you've got your touch points and you're constantly going in and knowing, that bill is going to become effective on, say, July 1st of 2025, no one's going to be surprised. You're going to have been constantly monitoring this, notifying them that this is rolling down, and then you start that implementation process. But usually my C-suite is the first group I go to kind of pressure test.
Yeah, I think that's smart. What would you add to that, Laura?
Well, I like to be friends with the regulators. So I like to try to get in on the skinny before it actually becomes public. So that really requires active engagement, really trying to build those relationships. That's, again, to what Donna was saying about joining industry associations, but also taking and perhaps developing pilot programs and running them by our regulators. If we reviewed critical care services through this lens, how would you think about that? And trying to get the pulse before it becomes an actual heartbeat, I guess, to try to get a feel of what's happening in the future, and then developing pilot programs so that we can pivot quickly depending on the changes of the landscape.
Oh, that's great. Donna, anything to add there?
Yeah, I think you brought up price transparency before, and I think that's a big focus right now. And so what we've done is actually leverage, we have an external internal audit partner. So we've leveraged them to be an independent third party, sort of an auditor on what we have in place. And does it pass muster? And you talk about AI and CMS having sort of, an AI focus on looking at hospitals' websites to make sure their price transparency files are meeting the regulations. That's how we've done that. And we've engaged the operational leaders who are responsible, whether it's revenue integrity or parts of the revenue cycle, to be part of that assessment. And we call them an assessment because we don't want to ever, someone to get the feeling that we're internal audit or we're compliance and we're here to whack-a-mole and hit somebody over the head. We're here to really test the waters, as you say, make sure that whatever it is going to pass muster, and that we can build the business so it's more successful. So we don't have a fine or we don't have an audit letter. That's what we try and do.
So there was a through line across all those answers, and Stephanie said active engagement. Laura talked about being friends with the regulators and engaging with them. You talked about engaging as well, Donna. And I just feel like that is such an important thing that's maybe obvious, but I just can't stress it enough. Like, this role is not we can't be wallpaper. You know what I'm saying? We have to be out there. We have to be engaging with leaders, with our counterparts in different departments, with these regulators. And I think once those conversations, as Stephanie has said, once those conversations have been had and it's an ongoing conversation, then when it's time to do something, people aren't sort of caught off guard, or they don't feel like, the rug's getting pulled out from under them. So I'd like to talk a little bit about, like, what advice would you give somebody who doesn't feel like they have the level of engagement that you guys have, or they're not like engaging the way you guys have kind of, alluded to? Like, what would you tell them? How would you encourage them? Let's start with you, Donna. How would you encourage them to kind of get started, and like where to start kind of building those new pathways, with their stakeholders?
I think it's really important to think about part of our role is about marketing. So you can't always cry wolf and say, oh my God, the sky is falling down, this is coming, it's really about marketing your program and how are you able to translate that into a message to an operational leader or a C-suite leader who has a million things going on that you could have a soundbite to catch their attention. And that may mean that you're meeting with different key leaders twice a year, 3 times a year, that you're going to them, you're forming those relationships. It's so easy now to just stay where you are and not make those efforts. And it's even harder to make the effort now than it ever was, but it's key. And the engagement on the marketing side is really, really important. Even with your marketing leadership, they can help you. They can help you sort of emphasize, what is the tone? What is the tenor? How can you help me get this message across? Very often we'll reach out to our marketing department and say, we're going to send out this message to 20,000 people, our workforce. Can you take a look at it for us? Can you help us with that? And I think that's really key in this day and age.
I mean, if your toilet's broken and your neighbor is a plumber, you would naturally go next door and say, hey, can you take a look at this? Or, hey, help me out with this. To your point, we have all these departments all around us that have specialized skill sets that we can borrow from to, again, not reinvent the wheel. Laura, what would you add to what Donna said?
Yeah, thank you. So I am grown now, but I used to think that I was really clear and consistent with my messaging. And it wasn't until I was starting to I was soliciting feedback and going through the content is fine, but what about the message? Tell me more. I need feedback from you so that we can do our work better. And some of the feedback that I received over the years and have been able to evolve from it is that the messaging sometimes would get lost. So even though we had a great job aid that had bells and whistles and it looked really, really cool, the message was lost. The deliverable was ambiguous. So I think our stakeholders, if they're providers, if they're leaders, if they're workforce members of all shapes and sizes, we need to make sure that the message is consistent. Now it changes, right? You're going to have different ways that you deliver your message, either through training and education, through outreach, through just simple engagement. But the message needs to be consistent. And that's something that I've learned over the years, that you just can't, you have to stick. That is the ultimate foundation of being successful. If people could come back and say they are consistent with their messaging, I understand what the deliverable is, you can then spawn off and figure out different ways to deliver it. But it always comes back to that persistent and consistent messaging.
And what do you think the core of that evolution was for you? I'm sorry to interrupt, but what do you think the core of that evolution was? It sounds like it was really kind of a focus on the end user, like keeping that end user in mind. It doesn't matter, to your point, if it's got all the bells and whistles, if they don't read it or they don't walk away with that knowledge.
It was a humble sandwich with many vegetables and pieces of meat in it. You know, it was really somebody, when we sent out a survey, you know, and we we're going to have a survey, we're going to get some feedback. And some of the feedback was we asked for it, right? We asked for the clear and consistent feedback, and we got it. And it hit me in the gut because I was going forth, but I had to change my angle. I was looking at it through the lens of a compliance and ethics nerd. I wasn't looking at it through the lens of a patient care technician. I wasn't looking at it through the lens of a unit secretary or of a pediatrician. And that was really helpful to get the feedback of you have a lot of energy, but I don't understand what you're really trying to tell us. And we really then were able to pare down to, let's just have, instead of 6 objectives, learning objectives in our messaging, let's get down to 3. Let's find a way and do some more we went through professional development. We went through a train the trainer. We continue to do those series to help us remember and stay focused on who the end user is and what information they need to be successful at their own job. That helps us be successful in our job.
Yeah, they don't have to be a compliance nerd like all of us are. They just need to be a healthcare nerd, and they just need to know what they need to know. Stephanie, what were you going to add there?
Well, I was going to say that, you know, it's a regulatory change coming to the organization, right? And it's not just legal and compliance's function or responsibility, it's the organization's responsibility. So, you know, in summing that up, you know, as we talked about, you've got to have that great messaging and that great trust from your organization. But at the end of the day, this regulatory change is coming whether you like it or not. And you've got to, you know, we've got to make it happen. And so, you know, at the end of the day, it's everybody, you know, it goes back to it's everybody. Compliance is everybody's responsibility. It's not just the legal or compliance team that's got to, you know, effectuate this regulatory change that's coming through the organization, good, bad, or indifferent.
And there's some nuance in what you said, but I think it's an important reframe because to some extent, we can't really be responsible for the compliance because the compliance happens throughout the organization. What we're really responsible for is trying to create the circumstances for success, trying to create the circumstances for compliance, which is obviously a transfer of knowledge. And I want to kind of park it on this training and development thing a little bit because this is really kind of the last mile in many cases in terms of like actualizing or activating the human sensors in our organization. I mean, if you zoom out, our job is really to kind of crowdsource risk intelligence, put those guardrails there for the organization, provide those insights back to the point of risk so that we can provide better patient care, so that our businesses can grow, so we can improve the bottom line and so forth. So when it comes to training and development, what training approaches do you suggest for staff to ensure that, you know, they can understand and effectively implement the new regulatory requirements, whatever they may be? You talked a little bit about keeping the end user in mind, but Donna, I'd like to start with you on this question. What kind of tactics and what kind of framework do you utilize to help increase the odds that, you know, a new regulatory requirement actually gets digested by the stakeholders that you're trying to influence?
I think that whether it's a regulatory requirement or anything else, you have to do different modes of communication. So you could try sending an email, but you should have a meeting. It really depends on it, depending on the issue. But I think as adults, we tend to need to hear a message different ways and different times in order to absorb it. So what we try and focus on is being, what I say all the time, be clear, be concise, and be gone. So get that message out, be clear about it, and then leave. Because if you drone on and on and on, you're going to lose them. So,
right.
So different things, whether it's a town hall with a specific group, whether it's the email, whether it's talking to their leadership, whether it's going to their staff meeting, whether it's recording an education and keeping that on Teams, setting up one-on-one. So we try all these different things. And even in the broad scope, when you talk about annual mandatory education, what we're going to try out is actually a game show and using our senior leadership, because don't people want to see the president of the organization, do they know compliance or not? So, I mean, not this year, but we're going to try that in the future, and trying to really get those key messages, regulatory, privacy, compliance, whether it's conflict of interest or policies, using the tools we have and kind of human interest to really engage people. People love stories, and they kind of like things they could follow that's a little bit different. So
love that.
Those are the messages.
Laura, what would you add to this?
I think the teach back is what's important as well. I learned this during my time at Sutter with Sabrina Butler. Hi. It's one of those things where we walk through a vignette of a new regulatory change or a policy change, and then had that interaction with the audience. Now, you can do that through a learning management system and playing back and watching a video and then selecting, a multiple choice answer. But that live interactive allows for some of those sidebar comments and conversations to organically grow to help problem solve some other things that may be coming up as well. I really think also, again, going back to leaning on others within the organization, that cross-functional collaboration. How can you key in and partner up with the quality team, with the nursing leadership to help piggyback and get on top of some of that work? If there's a regulatory change that impacts them, how do we get them to help with the messaging as well?
And I think the consistency, it's not only when something's going to happen, it's when things are quiet, being a part of that core, setting it up. And so when something does happen, they think, oh, I've got to call Laura, or, I've got to call Stephanie. That's the key there, wiring it into the fabric.
Well, back to my toilet example. Can you tell my toilet's broken? Back to my toilet example. Like, if I've never talked to my neighbor, I don't even know that he's a plumber. Or it's going to be weird to introduce myself and say, hey, I heard that you're a plumber. But if you've gotten to know this person and you have that kind of relationship, and that pathway's been kind of, trodden a little bit, it's so much easier for, that to be followed in a new circumstance. Please go ahead, Stephanie.
Oh, I was just going to say, one of the things that we've done that's been helpful is ask for feedback. So we've sent out, surveys. And as I said, it's definitely been eye-opening and humbling sometimes when you're sending those out and getting feedback. Yeah. So again, you're able to quickly pivot, but you have to be brave enough to consistently send them.
I have my team pull out all the negative comments on my 360s, and that's helped me a lot. Okay.
They get extra points for that.
They do, yeah. Bonus season's coming up. Okay, a couple of really good comments here I wanted to share and get some reactions. This is from Elizabeth. Elizabeth, thanks for sharing this. How does this new reg impact your role and your scope of practice? That message needs to be delivered to the people, to the boots on the ground.
Love it. Absolutely. And you need champions there too, right? To help continue the socialization. Compliance can't just sweep in and be like, I have a message and then take off. How does it live with their work in the day-to-day? How do they operationalize that policy or that regulatory change to make it just a part of the air that they breathe and what they do and why they do it?
And also know where to go to get it, where to look at it.
Yeah, where to find it, where to go with the questions. I'm doing a session at Compliance Week, and with the one and only Ellen Hunt. She's on my Mount Rushmore, I think, of compliance people that I've learned so much from. But she had a metric that she likes to measure of how many questions. Of course, we're looking at actual reports, but how many questions are we getting? Because that's an indication of people knowing, to your point, Donna, like where to go for things.
We also measure how many, the workforce in general, what are the top 5 to 10 policies that people are looking at within the month. to try and see, are we missing something? Is there something we're not noticing? So that's a point we're looking at. And again, when we go talking back to AI with policies, I think that's a whole horizon for compliance to just try and automate it, similar to what you showed us at the beginning, Nick. How can people ask a question? Because it's frustrating, even when, you're able to kind of search and put a couple letters and a policy will come up. But I think that's the next step for policy management in the compliance realm.
I love that. How long were they in the policy? How often it was accessed? Who are your top hits of those policies? Right. When was the last time it was renewed or revised or socialized? Great. Yep. I love that.
Sandra added a really good comment here. Figure out how our company is going to address the updates. Thanks for this, Sandra. Making sure that they understand the why there is a change in reporting, then explain the how we are going to comply with the updates. I've seen a lot of people fall flat on this by not talking about that why. How do you teach your team, or how do you, if you agree with this, how do you, operationalize this approach to increase the level of engagement and ultimately the adoption and the higher compliance to these new changes?
I think that's key. I think telling stories and really training the team to not to think of this as a relationship, and why does this happen? Why are we asking what we're asking? Why are we doing this investigation? Giving a similar story as to what, not everything is the same, but people relate to stories. So if you're able to kind of build in a story about the why, the person will more likely to remember it when the issue comes up again. So I think the why is incredibly important. Thank you for bringing that up.
I absolutely agree. I mean, I've got the dual role of general counsel, and I always tell people it's the counsel. So explaining the absolute why behind it, telling that story, it breeds integrity, truth. You know what you're talking about, and they're going to trust that she's not asking me to do this, and you're going to get buy-in. So, I do that from the beginning when I'm explaining what regulation's coming out to my C-suite, and then when we start that cross-functional process of bringing in the department heads and so forth, and creating that communication plan and operational plan on how we're going to operationalize and how much this is going to cost the organization and so forth, on how we build that out, which is just a reality. So to me, the how is very important. That is a tenet of my job of counseling.
But you said something important. Well, you said a lot of important things. But one thing you said was that we need buy-in, but that buy-in is predicated on that trust. If that trust isn't in place, then the odds of getting that buy-in is not nearly as high as it could be, Absolutely, because compliance sometimes can be seen that department that, cries wolf, the sky is falling, that's reputational risk there. So you always have to be careful that you've got that trust and that you're measuring out, the truth and on how that regulation is going to pan out and how much time and energy it's going to cost the organization to get there. So if we're teaching, go ahead, please.
Sorry.
No.
I'm just laughing thinking about that, because it really is in the message and how you're received that we've been told in the past. Perception is reality. And I'm just laughing because I'm looking at myself wearing pearls. And I sometimes say to my stakeholders, to help ease them and to help build trust, I may wear pearls, but I don't clutch them, right? There isn't anything that you're going to say that's going to spook me or scare me. But it's also not just me. Let me just add to this that I am afforded the opportunity to have a larger department than Stephanie, right? So it's not just Laura in compliance, it's Alex in compliance, and Akidra in compliance, and Lynn in compliance and privacy, so that they know that the compliance and privacy department as a whole, they are reliable, they are consistent, and they are supportive to our business goals.
Which actually, I was going to say, brings up a really good point, Laura, is that different people within the compliance department have different functions. So it's always important, in my mind, to make sure that we spend an adequate enough time training our own staff so that the privacy folks understand what revenue compliance is doing. And revenue compliance understands what the compliance and conflict of interest and policy people are doing, and what, internal audit or compliance and monitoring. So sharing that information monthly or however you want to do it, to me, is important to reinvest in the staff for compliance so that it it benefits the whole organization.
Yeah, and that understanding is multiplicative for sure, but it also helps ensure that there's a united front. You know, like an orchestra has 20 different, I don't know, I've never been to an orchestra, but they got 20 different instruments.
A lot,
and
they have a lot.
Yeah, it's got many, okay? It's got many different instruments, and it only sounds good if they're all kind of playing the same song and they're all kind of harmonized together. And if we're not spending that time making sure our own house is in order, how are we going to ensure that we have a consistent, you know, integration with the business?
Right. I think it's important.
So if you know, some of us on this call might have a policy tool, some of us on this call might be using Google Docs or something like that. And I think keeping these internal policies current is a continuous challenge, you know? How do you evaluate updating existing policies and procedures to, you know, really ensure that the ongoing compliance is evolving with these regulations? What are some of the best practices that you've developed and utilized over the years?
So
let's start with whoever was talking. Just kidding.
Go
ahead, Donna.
You want me to
yes.
start?
Yes.
So I'm glad you asked, because compliance was afforded the opportunity, I like how Laura says that, to be responsible for policy management as of October. And prior to this, I thought all the policies were up to date. No, not so much. So from our standpoint, I think part of what has to do is making sure your system is accurate in terms of what's a policy, what's a procedure, what's a protocol, what's a guideline. Number one, educating the staff on how to get to it. You know, we are in a process of re-educating our workforce, because we've had turnover over the years since COVID, how to even use the system. Number one. Number two, and then making sure you have a easily understandable policy on policies, or whatever fancy name you want to give it, so that you're ensuring that there's not duplicates, that nursing knows what pharmacy is doing if they're both named in a policy. That's their stakeholder meeting. We have a policy oversight committee that reports up to our system compliance committee, which are all the executives in the organization. And then I take that feedback and as well give that to our audit and risk committee. It's a committee of the board. So I think the communication, making sure people can have meetings with the policy team, and, you know, hopefully putting some AI into it is really where we need to go, so the frontline staff can get to what they need to get to when they need to get to it.
Can I just
Laura,
say I'm
you?
loving all the comments that are coming in. It helps validate us as presenters that we're saying the right things and doing the right thing. Just love it. I work in an organization that's highly matrixed, that has multiple policy owners. So for our work, and it feels like policy work is a full-time job, right? It is something not just for your own internal policies, but also identifying and being a stakeholder to other policies as well. So again, going back to that stakeholder engagement, being friendly, approachable, reliable, finding out what is on the horizon. Is there a policy informs committee? Do they all work together? Do they work across the enterprise? If not, how can you get in on some engagement? And also having a cycle for policy review is really key. When I go to other organizations, you know, when I'm looking for something, I'm in constant benchmarking. And that's why I love that you have a benchmarking report that just came out, because I'm always looking to see what other institutions are doing, especially other academic medical centers. And when I go out and I see a policy online and look at it and it's outdated, I get kind of a womp womp, because it's really important that policies are current. It tells the story of we're staying on top of it. We're informing our workforce members and stakeholders to stay on top of it as well. So it really is important to keep the good policy vibes going and really making sure that you have a formal plan that goes throughout the year. So if that means breaking up X amount of policies per quarter, making sure that your code of conduct is the crown jewel of all the policies that come after that, and really just having a plan and using that as part of your risk assessment as well.
So we're at 4,044
Oh,
emojis.
wow.
New record. I called
Record?
it. Did I not call it? I told you. Okay, 40 minutes in, 100 per minute. So how's that for some validation for you? What would you add to that, Stephanie?
I would say that, you know, policy, you know, we do it the same time every year. We do have somebody asked in the chat, you know, what's the why of having a policy governance committee? I think that's super important, because you're going to have consistency, and it brings focus. because again, it's easy to get stuff off the to-do list and you're just like, oh yeah, we meant to do that last year. But if you're doing, for me, you can do it quarterly because you're saving time, and I get that approach as well. We do it at the same time every year, and it is a long slog and process to make sure everything's updated. So I'm sure there's probably better ways to do it, but we do it through a governance committee. So it allows consistency across the entire organization on all policies. They look the same, they feel the same. Record retention, it's tied into the record retention. So we're very methodical about it.
Is that similar? Donna, you have something to add to that?
The other piece is input, that if you have the key stakeholders on that policy, we update our policies every 3 years. But if you have the key stakeholders on that committee, you have representation.
Yep.
Some people, I've found policies are very near and dear to them. And it's important. Yeah. They are emotionally invested in them. So you need to honor that and work with them. And so
leverage it, by the way. I mean, that's an asset. Leverage it. I mean, to your point, that's an asset. That's something you can really use,
Of course. I didn't know that when I started this. I had no idea people took it emotionally, but they do. So,
and let me just add to that. So you have a 3 hour policy change cycle, a 3 year, and we have a 3 year as well, but we always make sure that unless there are regulatory changes, and that is when, and the only time really that we would make a policy change is when those regulatory changes happen. So again, making sure that you are on top, you are like, exhaustively on top of all the regulatory changes, because they do have a downstream impact. They do impact policies. They do impact procedures. They do impact books of business. And then having to change those policies when needed, or making addendums or some side procedures without having to, slow down the work and grind it to a halt to keep the work going.
To your point too, Laura, we also try and make sure the policies have a regulatory or a legal reference. And if not, then it's a procedure or a guideline, because less is more in this realm.
Yes.
You don't want to have a policy that you're not following. So that's another piece.
Let's talk about that a little bit, please. Go ahead.
Well, I mean, that's part of our education in terms of where I have wonderful staff, a wonderful manager and a team that does this. And so part of the education is how in our policy do we define what a policy is, what a procedure is, what a guideline is. And the organization would make its own policy to do such. And then working with the workforce as we're reviewing all these to ensure that it fits in those correct boxes. With the mantra, less is more. Someone wanted to make a policy at one of the hospitals to not put anything up on the wall. Well, really? How are we going to enforce that? I mean, if that's your guideline, okay, that's different. But when you talk about policies, that's what the regulators are going to want to look at, or the auditors when they come to see you.
Yes.
What would you add to that, Stephanie?
I would just say I've been on the other side of it when the regulator or the surveyor is in and, they're going, hey, I'm going through your policies. And then you find the deficiencies, right? Mm-hmm. So it is and that's why having the policy governance committee, again, everything's laid out and it's the same group of people, same group of stakeholders from all the various departments, and you're getting that consistency. And so I think when you have silos, that's where you're going to have errors. And so I've been on the other side from a legal standpoint where, you've got a policy and you're not following it. And then you're having to, draft up a million different responses on why that occurred and why that happened. So
I think everybody can see. Oh, sorry. I think everybody can see if a policy is not being followed, right? If you have a stupid policy, the average stakeholder's like, there's nothing's supposed to be on the walls. There's stuff on the walls all over the place. What other of these policies don't matter? You know what I'm saying? If you're at the pool and it says no running and everyone's running, it's like, all right, well, that's not a real rule. You know what I mean?
I like the comment about the silos and errors. That's really good. I'm going to take that back.
Can you share it? I didn't see that one.
Stephanie, what were you just saying about the silos?
I was just saying, I mean, when you don't have, that's why I had the policy governance, because everybody cannot be in silos, because that's where you have gaps in processes.
Right.
Other people aren't realizing what other people are doing. Mm-hmm. And that just leads to errors, penalties, fines, and so on.
It's true.
A great question from Nicole. Nicole, keep these questions coming. Thank you. How often is policy management a part of compliance versus other areas like legal or HR? Is this a philosophical question, or is this a true kind of best practice type of a question? Maybe we'll start with you, Stephanie. and then we'll go to
Okay.
Laura, then Donna.
I'm not sure I understand the question.
Like, who owns the policy management process?
Right.
Is that does compliance
Typically.
own it? Does legal? Does everybody kind of
No.
own it?
Yeah, I mean, well, I guess it depends on where it's coming from.
Classic lawyer.
Sorry. I would say they always want to put it on the compliance/legal department. Absolutely. Absolutely. Why? Because we're good at drafting the policies and procedures because they make sense and, use of the English language, right? So we're good at it. But that's not a great answer. So I'll punt this to someone else.
That's an honest answer, though, and that's probably a very real an applicable answer to many of the audience members. Again, I live and work in a highly matrixed organization. So we do have a policy committee that has its own governance, but as a shared service for the faculty practice plan, we do have our own policies, as does our HR, risk management, and revenue cycle. Alex on my team has worked closely with our legal department to develop our policies over the years and make sure, part of her work is to make sure that anything we say doesn't contradict any other policy within the organization. So it's a lot of management and working with different stakeholders. But we do always make sure that our policies are signed off by legal before publishing.
How about you, Donna? Anything to add here?
I think it just depends on your organization, and there's I think a propensity in bigger systems, just my opinion, to put it under compliance because we're going to tick and tie. We're going to make sure that it happens, whether it's annually at Stephanie's organization or it's every 3 years. There's that kind of level of responsibility, and there's a heightened perception that if compliance reaches out to you, there's a thought, people will react, they will do what they need to do. So I feel like that's why before for us, it was under quality and it got transferred over here. So I think that's kind of why.
So, I mean, I think there's a lot of freedom in these answers. The answer that it depends is a very, gives us a lot of agency and gives us a lot of freedom, because this is not like those hundreds of videos I've seen of Gordon Ramsay criticizing somebody's attempt at making a beef Wellington. Apparently, there's only one way to make a beef Wellington, okay? This is not that kind of a thing. It's up to you to kind of put the ball in the net. It's up to you to understand your business, the resources that you have and so forth, and figure out what the best way is to get the people to do, the stakeholders to do the things that they're supposed to do. So I think the answer is it depends. To punt it again, to use that, like, it depends, and it's up to you to use your compliance brain and use your insights to solve the problem in the most effective way. So we had about 10 minutes left, and I want to talk a little bit about, the potential disruption that can come from us pushing new things out, right? These regulations are coming down. We've had our conversations. We're friends with the regulators. We feel confident that this change is going to be the right thing, but it can many times feel very disruptive on operations. So what kind of steps do you take to ensure that these compliance initiatives don't negatively impact operational efficiency or patient care or profitability, to too far an extent? Let's start with you, Stephanie. And you can't say it depends to this one.
I can't. I mean, that's a loaded question because these are regulations. I mean, typically they're going to affect operations. What do I do to use my my wand to try and calm down the COO who's going to have to implement this? Typically they are disruptive to the business in a sense. We're adding another consent that's got to be signed, or we're adding another checkbox or another documentation piece that's got to be done. We want to make it as efficient as possible and as painless as possible. But I guess I'm more of a realist in the sense that, hopefully they've practiced by the time we get there and we've got to be live on something. But I mean, truthfully, these regulations are always going to be somewhat disruptive. You want to minimize the disruption as much as possible.
That's
I know
great.
That's not a great answer.
That is great because it's true. I mean, I just always picture, us as like captains of a ship, you know what I'm saying? And like, if you're going across the Atlantic, there's tons of waves and there's tons of storms that you're going to hit. So like those sea legs, we have to get those sea legs, and, we have to get good at integrating change into the organization if we're going to, make it to the other side of the ocean. Laura, what would you add?
Thank you. You're just giving me so many ideas for our next job aid, which will be nautical themed at this point.
Cool. Very good.
I think let's take a look internally, right? What are the resource constraints? So the question I'll get from time to time is, well, how much is this going to cost me? How is this going to slow down our staff? Do we have the financial resources to adapt to these changes? So it's really about selling, back to what Stephanie said. It's a regulatory change. It's a rule. We have to abide. We have to comply. But if we can prioritize some of the critical changes, right, and leverage technology, try to automate some of the work, how to allocate some of the work and delegate, this is more palpable to those that actually have to cut the check to help us implement these changes.
That's a great point. Donna, what would you add?
I think that generally speaking, people want to do the right thing. They want to follow the rules. So trying to be empathetic to operations as how this might impact them. And just what Laura said, and Stephanie, how can we collaborate? We're going to be transparent. We talked about this last year in the risk assessment. Most people do a company-wide, organization-wide risk assessment. So if you know the risks, you can start to prep them and be transparent ahead of time. And the communication, not only written, but face-to-face or on Teams, and empathetic to the challenges they might see or have, and letting them know you're going to be there. We're going to support you through this. Your operations, but we're here to be, the wind beneath your wings. Another nautical reference.
I love this.
Write these down, please.
Write these down. Write them down now.
I need my Lindsay.
But I think that's, in my experience, people really appreciate that. Do they want to do one more thing, or have their department do one more thing, or sign another consent? No, but they understand this is what has to happen. We're going to be there with you. Would you like me to come to that department meeting and talk to your staff about this? I'm happy to do that. Let's partner on this. I think that makes a difference.
I mean, isn't it interesting?
Can I also just add to that? Oh, yes. I'm sorry.
Don't be. No, don't be. Go ahead.
I get really
Whatever
excited.
You're going to say is better than what I was going to say. I guarantee it.
Really excited, especially me.
I'm always excited when Donna talks. So it's one of those things. Also going back to Donna's motto: "Be bold, be brave, be gone." When you're ready to make these changes, you got to be quick about it, right? So a lack of coordination can delay those efforts, delay that buy-in, perhaps create inadequate processes or systems. So you got to get in there. You got to have a plan of action. You need to have clear change management, and you really need to be the leader leading that ship through the storm of change.
It's perfect. You see what I'm saying? It's perfect. Isn't it interesting though that like such a critical characteristic of like great patient care is empathy, and also for us to be effective as compliance executives, compliance professionals, we need to have that operational empathy. I've never heard that term before, Donna, but I love it. But it's so critical. It's keeping that other person in mind. It's trying to put yourself in their shoes and trying to, which can't happen unless you understand where they're coming from, understand what their actual reality is. Like, we're never going to throw the football through the swinging tire if we don't see how it's moving. You know what I mean?
Right. Well, you said, it's understanding the business and what are the challenges. We might not know how to, take care of a patient in the ICU or what, but we understand the nature of the business and the pressures that nursing is under, or respiratory is under, or what have you. So it's having that empathy and explaining the why. Again, all the communication pieces we've talked about today.
So we got a couple of minutes left. We got a couple of great questions in the chat. I want to do a little bit of a rapid fire here. So Christine, hey Christine, thanks for this question. If you're new to the compliance world, where can you learn to draft policies? Let's start with you, Stephanie.
Where do you draft policies?
No, like if you're new to the game, what advice, like where would you tell someone to look to draft better policies or to get started on drafting good policies?
I don't know. I'll punt this one. I mean, I've been drafting policies for years.
You could do it in your sleep now. All right. How about you, Laura?
I don't know. I don't have a good answer for that one.
I love tapping into other people's knowledge. So I like to read. I don't like to develop policies. I'm a delegator of policy development. I have a full disclosure, full transparency there. But I love reading policies because I really want to know the why. That's how I buy in as a stakeholder, and that's how I expect others to buy into my program and my plan. So I really do a lot of reading of other policies. There are many out there that are published. A lot of state institutions are required. The University of Washington Medicine was one of my first places that I dipped my toes into to policies. See Emily's here. Hi. And it's great to still go back and read their policies today and go, well, what works for me? What works for my organization? And really taking from that, making it your own, of course, but then really getting down to making sure policies are slim and effective. You know, they also need to be bold, brave, and then revised and reviewed as necessary. But really just looking into how others, I really like to ask for help to be consistent, not just at my organization, but at other similar enterprises as well.
Thank you. What about you, Donna? What would you add?
I would ask colleagues from other organizations, and I would Google it.
Yeah.
I would say, engage the case method. So copy and steal everything. Steal them, copy them. Okay, creatively borrow from them.
Be inspired.
ChatGPT
I like to be inspired.
Any word you want to call it. Okay. But again, you get no bonus points for reinventing the wheel. There's great stuff out there. Everybody is so open. In this industry, in particular, everybody is so open. I mean, that's why we're always talking about building the network and connecting with more people. When you can pick up the phone or you can drop a LinkedIn DM and ask somebody a question that you met at a conference or that, you've met on a webinar or something like that, you're going to get up that J curve a lot faster. And I think that's all right there for us to take care of. So we are right at time. Let's get one more emoji explosion for these guys. Amazing. Really amazing. This is a really a great session. High rewatch value. Of course, free CEUs for everybody who comes. And thank you guys so much for being so generous with your insights and with your advice. This is really a great episode.
Thank you. This was great.
So happy to be here.